Hello, everyone, and welcome to today's AML Caregiver Chapter event brought to you by the HealthTree Community for AML program. My name is Katie Braswell, and I'm the HealthTree for AML Community Director. I'm very grateful to have each of you here for our meeting today and for your support in building this AML caregiver community. I'd like to let you know that today's session will be recorded, and the recording, along with the slides and any resources we discussed today, will be sent via email to all registrants within 48 hours after the event has concluded. I'd like to start with a brief Zoom meeting tutorial for those that are new to using the platform. We'd love for you all to turn on your cameras and keep them on if you feel comfortable. Doing so helps us to create a stronger sense of community. You can see on the slide how to turn on your camera. At the bottom of your screen, you should see the microphone and camera buttons. You can click the video icon that says Start Video in order to turn your camera on. With that being said, if you're not comfortable being recorded or you're not required to keep your camera on, your microphone should currently be off and will be kept off by our team throughout the presentation. During the group discussion, you're welcome to unmute yourself once you're called upon. If you have any questions or comments for us or for our speakers throughout the presentation, please click the chat icon and type them in the chat box. If you're using a mobile device or a tablet, click the three-dot icon that says More and then Chat in order to access the chat box. And lastly, if you would prefer to verbally ask a question or make a comment directly to our speakers during the discussion time at the end, we encourage you to do so. If you're using a laptop or desktop computer, click Reactions near the bottom of your screen and then click Raise Hand. If you're using a mobile device or tablet, you can click the three horizontal dots that say More and then click the Raise Hand button. Now let's get started with today's event. First, I'd like to thank our sponsors, without whom this event would not be possible: Bristol Myers Squibb, Amgen, Genentech, AbbVie, and Jazz Pharmaceuticals. The topic of our event today is titled Helping Your Loved One to Stay Nourished During and After AML Treatment. Here's the agenda for today. I'll introduce our speakers, Michelle and Kathryn, and they will spend the next 30 minutes or so giving us their presentation. After the presentation, we'll open it up for your questions and comments and end the event with a few announcements. So let me take a second to introduce our speakers, Michelle Hamilton and Kathryn Kanter. Michelle is a registered dietitian and certified specialist in oncology at UT Southwestern in Dallas, Texas. She received her undergraduate degree at Baylor University and master's at UT Southwestern. Michelle has been an oncology dietitian for approximately 5 years with a special focus on cancer survivorship, in which she leads a 6-week healthy eating class for oncology patients. Kathryn is also an oncology dietitian at UT Southwestern. She received her bachelor's and master's degree from St. Louis University, where she also completed her dietech internship. She began working at UT Southwestern Clements University Hospital in 2015, where she specialized in oncology and critical care nutrition. In 2020, Kathryn transferred to Simmons Cancer Center and now primarily works with patients with hematologic malignancies, such as multiple myeloma, leukemia, and lymphoma. We are so excited to have both of you here with us today. And so with that, I'll let you, Michelle and Kathryn, go ahead and get started.
Thank you, Katie. Go ahead and get the presentation started here today, which I believe Katie is going to go ahead and send out a copy of these slides after the presentation is over. So we'll go ahead and get started. Like Katie mentioned, my name is Michelle Hamilton, and I'm here with my colleague, Kathryn Kanter. First off, we wanted to really highlight that a person's diet and nutrition during treatment can greatly impact their ability to tolerate the treatment. Nutrition can also help decrease cancer recurrences and improve well-being while on and off treatment, and sometimes even correct nutrition deficiencies. So really just highlighting what we eat and drink can make a big difference. Treatment symptoms can really vary and are individualized based on treatment, dosage, and your loved one's ability to tolerate the symptoms. So this list contains several of the common symptoms, which we will cover, that are often addressed with patients, and we'll go through these individually. Because poor appetite is one of the most overarching symptoms during treatment, we'll address this symptom first. So poor appetite can be due to multiple reasons, including additional symptoms like diarrhea or nausea, environment, sometimes anxiety, medications, and so forth. Sometimes setting an alarm at certain times of the day to remind yourself to eat or your loved one to eat can be very useful when eating really just is not a priority or it doesn't feel like a priority at that time. Additionally, eating at the same time each day can often encourage the stomach to produce hunger signals and possibly a better appetite. We encourage patients and loved ones to start small and really set realistic goals. It's important to really take things one step at a time. One goal I always set with my patients is to reframe their mindset from eating healthy foods to eating calorie-dense foods if weight loss or poor appetite occurs. So just a reminder, these are the kind of goals that we discuss during treatment, and Kathryn, my colleague, will discuss more information on nutrition goals after treatment. So these are just kind of temporary measures that we take. When dealing with a poor appetite, we recommend that you consume foods and fluid that provide the biggest bang for your buck. So high calorie, high protein liquids are often easier to consume than sitting down to a large meal. That's why sometimes those supplements can be helpful. If your loved one would rather eat than drink your calories, we recommend kind of making each bite of food count. So focusing on those really high calorie, high protein foods when we can, to make sure every bite, is making an impact. If you have the best appetite in the morning or in the evening, we recommend that you capitalize on those times in order to reduce weight loss. So kind of focusing on, getting the most in whenever you're feeling the best. And then lastly, cravings are something that we really encourage during this time. So stock up on some of those favorite foods that may be a little treat or something to enjoy during the day. Listed here are some of those high calorie foods. So this list is certainly not comprehensive, but rather just a couple options to consider. If possible, we really recommend consuming some of those healthier fats like oils, avocado, nuts, and seeds, but these are all great options. Treatment can affect your oral health in a variety of ways. So a few of these side effects are listed on this slide, and that includes mouth sores, mucositis, which is the inflammation or irritation to the lining of our mouth, and throat, and dry mouth, or even oral infections such as thrush. This can affect how your loved one eats or drinks and talks, and can definitely affect diet and nutrition. Depending on the treatment and recovery, it can be temporary or it can last for several days. And with good oral care, the goal is to reduce the severity and improve the recovery time. So what are the recommendations with a sore mouth? Continue to practice good oral care, good brushing techniques, and maybe even speaking with your dentist for some additional suggestions. A few foods are listed here, but think of things that are soft and easier to chew, and try to limit some of those dry, crunchier foods like chips or toast. These can be a little too rough in the mouth and cause more irritation. We want the mouth to heal as quickly as possible. If you're struggling with a sore throat and a sore mouth, sometimes chewing thoroughly and taking smaller bites can be easier and less painful. In order to keep foods moist and add flavor, it's maybe something to consider adding a sauce or a marinade or a gravy to your foods, and choose moist methods of cooking, such as steaming, or those crock pot meals can be really helpful. And try to avoid anything that's too acidic or spicy, because again, that may burn and irritate the mouth. Dry mouth can be another common side effect. It can be caused by a variety of medications and treatments, so it's often difficult to pinpoint the exact cause of dry mouth, but the really important thing is to focus on drinking plenty of fluids and staying hydrated. So this does include water, but other fluids and liquids can help, such as watery foods or fruit, popsicles, or even ice can be beneficial at times. Really try to limit caffeine because it can be dehydrating and it can also dry out the mouth. Sometimes sour flavors or even papaya can help kind of break up thicker secretions, but just be careful if your loved one's experiencing a sore mouth in addition to the dry mouth. And then if you experience dry mouth at night or first thing in the morning, a humidifier may be helpful, but make sure to clean the humidifier on a regular basis. Moving on to taste changes, dry mouth and taste changes often go hand in hand. We really rely on the FAST acronym, which stands for fat, acid, salt, and sweet. So try adding oils or even butter, avocado, sometimes mayonnaise to foods to override some of these taste changes. Now, if the foods taste too sweet, we often recommend adding some kind of acid when able to kind of balance out some of that sweetness. But again, if you're experiencing a sore mouth, just use that with caution. Sea salt is recommended because of its lack of bitterness when compared to more traditional iodized table salt, but really just use whatever salt works best. And just a reminder that salt can sometimes cause high blood pressure or fluid retention in some predisposed people. So if you're concerned about salt intake, definitely speak with your dietitian or your doctor for more kind of individualized recommendations on that. Try different preparation methods, new foods, or even consume foods at maybe a different temperature to test the foods that may taste the best to your loved one. Sometimes, again, those homemade sauces or even a homemade spice rub can really help kind of customize the flavor profile and make a huge impact on how much they're able to eat. For symptom management, for nausea, you may be prescribed one or more medications to take at home. Really, your team of nurses and providers will provide most of that information, but it is important to talk to your team about these medications. And if they're not working for you or your loved one, definitely let your team know. From a nutrition standpoint, it's important to focus on small, frequent meals and really take it slow in order to prevent that overly full or uncomfortable feeling. When possible, try to drink those liquids separately from your meal. Some fluid is okay, but try to drink the majority of your water or fluid in between meals. Again, we don't want to overwhelm your stomach and kind of make the nausea worse. So make sure to stay upright for at least an hour after eating that meal. If you do lie flat, it can sometimes make you feel like the food is coming back up, and that's really an unpleasant feeling. We don't want that. For nausea, it may be beneficial to time your medications and time your meals around your medications, so that way you're feeling your best whenever you're trying to eat. And the last bullet, apologize, it's kind of faded out, but it's just a recommendation to try to get a little fresh air when needed and make sure that you're wearing comfortable clothes, nothing too tight to contribute to that nausea. As a reminder, these are really just a list of suggestions, so no hard and fast rules. What works for someone else may not work for your loved one. There may be a trial and error period to find the best routine or solution, but we encourage patients to just continue to try and really continue to update your team on how you're feeling during treatment. And once the nausea subsides, and our goal is always for it to go away as quickly as possible, then you can just return to a normal diet pattern. As you can see here, there's a common theme of avoiding those really spicy, greasy foods. Something high in fat can sit heavy on your loved one's stomach and maybe contributing to the nausea a little bit. Mild, bland foods, such as the brat diet, if you've heard of that, can be a good rule of thumb to get through kind of the toughest periods of nausea. However, that diet is meant to be used as a temporary solution, as it really limits a lot of nutrients and especially protein. Next, we'll cover a common sign and issue with AML treatment, and that can be dehydration. So here are a few signs of dehydration listed on this slide. Surprisingly, urine color can be a really good way to measure your hydration status. So ideally, urine color should be a light lemonade color. Make sure to keep track of that throughout the day. It's recommended to consume at least 64 ounces of fluid throughout the day, and this includes all non-caffeinated fluids. So that can include things like Gatorade and other oral rehydration drinks, carbonated water, juice, broth, all of those things. This slide gives a few additional examples of some foods that can provide additional fluid throughout the day. Sometimes additional supplemental drinks and protein drinks can be beneficial to help you meet your increased protein, calorie, and even fluid needs. Moving on to some of the GI symptoms, this slide provides some suggestions for diarrhea. Really, it's important to make sure to take the anti-diarrheal medication as prescribed. So although dietitians are all about food first, this really is a situation where a medication is needed to stop or slow things down. Try to stay hydrated by drinking plenty of fluids, but really avoid really sugary drinks because those concentrated sweets can make the diarrhea worse, and select kind of lower sugar products such as Pedialyte or like a G2 or a Powerade Zero that has less sugar. Consume foods that are higher in those electrolytes such as sodium or potassium. Some suggestions are listed on this slide. Soluble fiber like pectin can create a gel and absorb some excess fluid in the bowels, and this can really help slow things down. But it's important to speak with your provider or dietitian because not all types of fiber are recommended, and it may not be appropriate for your loved one. Bannetrol or dried banana flakes works really in a similar fashion. We have a lot of success with this product and recommend it on a fairly frequent basis. And bannetrol can be mixed with drinks or soft foods such as pudding or yogurt, and it needs to be consumed about 2 to 3 times daily. In general, it's important to avoid some of those gas-producing foods when you're experiencing diarrhea, and that includes things like broccoli, cabbage, or beans. And lactose in standard dairy products can sometimes be hard to digest and can contribute to nausea. So it may be beneficial to temporarily transition to a lactose-free option or a plant-based product. To help become more regular, we recommend setting a bathroom schedule to allow your body to synchronize with your schedule. Additionally, creating that schedule around your meals. For instance, using the bathroom after eating can be the best time to promote bowel movements because the gut is already working and is activated at this time. You can also increase your hydration, especially if you're increasing your fiber intake to help manage that constipation. If those tricks do not work, we also recommend consuming like a warm sugary beverage. So kind of the opposite of what we would recommend for diarrhea. We're going to be recommending that for constipation. And if possible, try to get some physical activity because that can really increase that gut mobility. Fiber for constipation is listed here. It's important to increase your fluid intake whenever you are adding fiber to your diet, and we recommend adding fiber very slowly. So look for foods that have more than 3 grams of fiber and choose more kind of plant-based sources such as fruits, vegetables, whole grains, and beans. The nutrition label here highlights where you can find fiber on the label. I know that may not be something that you're quite looking for now, but it is listed there. And then maybe consider kind of starting your day with a high fiber meal or adding bran or ground seeds to your meals. And you can add these things to foods like yogurt, oatmeal, or even salads. And then here, just briefly wanted to discuss opioid-induced constipation, and that can be, opioids are used for pain management, but it is a different type of constipation. So although I just talked about increasing fiber and those things, actually fiber isn't necessarily recommended for this type of constipation. So just want to tread lightly on adding too much fiber in your diet if constipation is related to some of those pain medicines. Instead, it's important to just get in some daily movement, daily activity if you can, stay hydrated, and then really eat a balanced diet.
Okay, so now we're going to kind of switch gears and we're going to focus in on long-term nutrition goals for survivorship. So once you're kind of past maybe some of those initial nutrition-related side effects that are being experienced with treatment. So we'll get into that. What we're going to do next is we're going to kind of go through some recommendations from the American Institute for Cancer Research on the next slide. The American Institute for Cancer Research is a really great resource to use. It basically gives recommendations from really great evidence-based studies and tells us information on how to first prevent cancer from occurring in the first place, but then also kind of tells us the up-to-date research on how to prevent cancer reoccurrence. So we'll go to the next slide here. They do have kind of 10 cancer prevention recommendations, kind of like a blueprint you can see here. We're not going to go over all of these just for the sake of time today, but we are going to focus in on a few of these. So first one is going to be a healthy weight. So we know that excess fat around our waistlines can be particularly harmful regardless of total body weight. And the reason for that is that excess fat around the waistline kind of acts as like a hormone pump, secreting excessive amounts of estrogen into the bloodstream. And we know that high amounts of estrogen can be a cause of certain cancers, such as pancreatic cancer, colon cancer, and breast cancer, among others. So the AICR recommends waist circumference of no more than 37 inches for men and 31.5 inches for women. But what's really good is that we know that research has shown even just a modest reduction, so 5 to 10% weight loss, is associated with decreased cancer risk. So even those modest losses really, we know, have a lot of benefit. We always recommend avoiding any kind of fad diets or yo-yo dieting, as we know this can be really harmful to long-term health. So we want to focus in more on just healthy eating, general good nutrition, trying to focus in on eating less high energy foods. So maybe a lot of those foods Michelle was talking about earlier, and focusing in more on some of those low energy or lower calorie foods. That's going to be foods that are high in water content, high in fiber, such as fruits, vegetables, whole grains, beans and lentils, and things like that. Next recommendation, be physically active. So we know that physical activity reduces cancer risk by 25 to 30%. And there's quite a few reasons that we think that physical activity is so beneficial for us. First of all, we know that it reduces inflammation, can lower glucose levels and lower insulin levels in the body. We know that chronically high insulin levels and chronic inflammation can contribute to cancer risk. Also, simply lowers body fat and helps maintain that lean body mass or that lean muscle mass, increases our metabolism, and also helps to increase gut transit time. So basically what that means is that it's helping food to move more quickly through our intestines, so that potentially carcinogenic or potentially cancer-causing foods are spending less time in the gut where it has a chance to be absorbed into the body. So basically it can be excreted faster. So of course we want to try to limit sedentary habits, such as sitting and watching TV, sitting at the computer. A lot of us are working from home for a good amount of our days. So it's important to always keep in mind how important it is to be up and moving around for at least 30 minutes a day or so. So next recommendation, eat a diet rich in whole grains, vegetables, fruits, and beans. Like I talked about before, some of those low energy, low calorie foods. So the AICR recommends filling up about 2/3 of your plate with a variety of vegetables, fruits, whole grains, and beans. And the other 1/3 of your plate should be a protein of some sort. And one key here is the word colorful. We really want to make sure that you are aiming to, what we say, eat the rainbow. And that doesn't have to do with Skittles. That has to do with making sure that you are eating a large variety of different types and different colors of fruits and vegetables, because we know that, let's say, a red bell pepper is going to have a completely different nutrient profile than, you know, purple eggplant or something like that. So it's important to kind of make sure that you are eating a variety of those fruits and veggies in your diet every day and every week. Limit consumption of fast foods and other processed foods that tend to be higher in fat, starches, and added sugars. We do recommend limiting salt intake to no more than about 2,400 milligrams a day. If you're eating foods that are mostly whole foods, so those fruits, veggies, whole grains, things like that, fresh meat, fresh fish, those are going to naturally be very low in salt. The majority of the salt in our diet comes from processed foods, fast foods, restaurant foods, and things like that. So of course, just adding herbs and spices to add flavor to foods instead of reaching for that salt shaker can be really helpful as well. Our next recommendation, limit consumption of red and processed meats. So we know that there is a link between colorectal cancer and red meat consumption, as well as processed meat consumption. So we always recommend trying to limit red meats to no more than about 12 to 18 ounces per week. Red meat is considered beef, pork, and lamb. Like I said before, we also recommend limiting those processed meats, things like hot dogs, bacon, sausage, deli meats, pepperoni, things like that, because of the way that they are preserved through smoking, salting, or curing. And one thing that's important to note is that you might see on labels every once in a while, no added nitrates. And really that's just a marketing ploy. In that case, they're typically using something like celery powder or salt to cure those meats, but they still are considered a processed meat and still should be avoided as much as possible. So then what do we recommend? Generally speaking, we recommend adopting more of a plant-based diet. It does not mean that you need to become, vegetarian or vegan or anything like that, but just being, careful to include more plant-based foods in the diet has so many health benefits. So there are a few different diets out there that kind of incorporate this idea of adopting that plant-based diet. So you may have heard of things like the Mediterranean diet, the DASH diet, vegetarian or vegan diet. Those are all popular and kind of adopt a lot of these same basic principles. And we know that this plant-based diet is so helpful for us and so good for us because lowers risk of diabetes, helps lower that LDL cholesterol, which is that bad cholesterol. It helps maintain a healthy body weight and, of course, lowers the risk of heart disease and many types of cancers. So like I said before, don't need to become a vegan or a vegetarian, but just adopting a few of these recommendations can be hugely beneficial to your health. So just a few examples of ways to reduce meat consumption, focusing first on just one meal or one snack per week to make completely plant-based can be a good place to start. You can also think of meat as a seasoning. A lot of times we think, when we are planning our dinners, that meat is the center of the dish and everything else is kind of planned around that. So thinking of meat as more of a seasoning or more of a topping for your foods instead of the star of the meal can be a good way to kind of go about it and think about it when you're planning your meals. Also just trying different ethnic cuisines. A lot of, especially Asian diets, use a lot of more plant-based options, things like tofu and tempeh, when they are cooking. And so trying to incorporate more ethnic cuisine can be a really good idea. Even just simply switching out, half of your, meat in a casserole for beans, substituting lentils for ground beef, or substituting white beans for chicken a few times a week can also be a really easy thing to do and a good place to start. So this is just an example of one of those more plant-based diets that I've been talking about, the Mediterranean diet. Old Ways is a really great resource for anybody who is interested in trying to adopt more of this Mediterranean diet. They have some really wonderful resources online, recipes, cookbooks, and things like that. But you can see here in this pyramid, at the bottom, we have, of course, physical activity as kind of the cornerstone or the foundation of this lifestyle. And then next we have, of course, our fruits, vegetables, whole grains, beans, lentils, nuts and seeds, herbs and spices, and of course our olive oils, our plant-based oils. And then up at the top, we have fish and seafood, followed by poultry, eggs, cheese, yogurt, some of those dairy products. And then at the very, very top, we have red meats and sweets, things like, cookies, brownies, ice creams, those types of things. So next I wanted to show y'all the AICR's list of foods that fight cancer. So while we know that there is no one single food that is going to prevent or cure cancer, we do know that there are some phytonutrients, antioxidants that are in some of these foods listed that we know have anti-cancer properties. And two that I wanted to really point out here that surprised some people are coffee and soy. I get a lot of questions about, do I need to stop, drinking coffee? I heard, it's, bad for you and you're not supposed to have it. Same thing with soy. It's a common misconception that those two things maybe aren't the most healthful, but we know that they really are, and they should be part of a well-rounded and healthy diet. So next recommendation, limit consumption of sugar-sweetened drinks. So I would never recommend, unless you have a history of diabetes restricting naturally occurring sugars that come from things like fruit, dairy products, whole grains, and those starchy vegetables, corn, peas, and potatoes, things like that. But we do always recommend trying to limit those added sugars that come from things like desserts, sodas, highly processed foods. So for women, we recommend no more than 6 teaspoons or about 25 grams per day. For men, no more than 9 teaspoons or 37 grams per day. And on this slide, you can see on the left, we have the old nutrition label. And then on the right, we have the new nutrition label. And we have circled here close to the bottom, underneath total carbohydrates, you can see that they now include how many grams of added sugar are in products. So it makes it very easy to identify if manufacturers are adding extra sugar in to their products. So I always recommend checking that out whenever you are purchasing foods that are, prepackaged, pre-made, things like that, just to kind of see how much added sugars could be in there, because it can be surprising sometimes. So one of the last things I wanted to go through with y'all is just a little bit of information on intermittent fasting, because that is something that I get asked about a lot, and I know a lot of our other dietitians get asked about as well. So we know that fasting is being studied right now as kind of a way to lessen the effects of chemotherapy, some of that reduced appetite, nausea, vomiting, things like that, that can sometimes occur after chemotherapy infusions. So there's a lot of research going on right now to kind of look at that. And there are quite a few different types of fasting that are being looked at. We have the 2-day fasting with 5 days out of the week being regular consumption of calories with 2 days of fasting. There's also overnight fasting, so about 12 to 14 hours overnight. And then there's also fasting mimicking diets, which you're not going more prolonged periods of fasting, but you are reducing total caloric intake to about 20 to 40% of usual intake of calories. So one thing we do know is in survivorship, fasting for 12 to 14 hours overnight may actually improve outcomes because it can kind of reduce the insulin in the body, which we know is good for us. So that's kind of some exciting research that's been coming out. So bottom line, right now, when it comes to evidence in human studies for fasting during active treatment, we don't have enough evidence to really be able to say, yes, we should be implementing these. So we'll have to kind of see where the research leads over the next few years. But someone who is well nourished and does not have a hypermetabolic cancer, who has not experienced a lot of unintentional weight loss, may be able to trial the fasting mimicking diet to see if it does help with some of those chemotherapy side effects that are sometimes experienced. But we definitely, like I said, do not recommend it for those who are having significant weight loss, hypermetabolic cancers, and also conditions like diabetes, or if there is concern for chronic low blood sugars, because we don't want those blood sugars to bottom out from prolonged fasting periods. So at the very end, I want to just go over a few considerations specific to AML. So unfortunately, there's not at this time a whole lot of studies as far as AML and nutrition goes, but we'll go over those in just a second. First, wanted to go through managing some long-term side effects of AML treatment. So this does depend a lot on the duration of treatment, the type of treatment, age, and overall health. But some of the chemotherapies that are used for AML treatment, we know, can lead to heart disease later down the line. So it's really important to make sure that following a low-salt diet and limiting those saturated fats that come from things like full-fat dairy, red meats, butter, a lot of processed foods and things like that, and making sure that you're including those good fats in the diet, things like those plant-based oils, such as olive oil, avocado, nuts and seeds, fatty fish, such as salmon. Anemia can also be common as well. So it's important to make sure you're getting adequate iron, folate, and vitamin B12 in the diet. That's going to come from things like dark green leafy vegetables like kale, spinach, collard greens, things like that. Red meats, more lean red meats, of course, and limiting to about 12 to 18 ounces per week, like we talked about before. Poultry, beans and lentils, nuts and seeds, sardines, eggs, and fortified grains as well are also good sources of those nutrients. One other big thing we worry about too, loss of bone mineral density, especially those who have been taking steroids. So it's important to make sure you're getting good calcium and vitamin D in the diet. We know calcium comes from dairy products, dark green, leafy vegetables. You also get some good calcium from fortified things, such as fortified orange juice. And then that vitamin D. Vitamin D comes from things like fatty fish, again, fortified products like fortified orange juice, fortified whole grains, fortified dairy products, and of course, sunlight as well. But it is important to remember, sometimes it can be hard to get enough calcium and vitamin D in the diet. So if you feel like you might benefit from having a supplement for those two, would be something to talk to your doctor about, see if it would be a benefit. So like I said before, unfortunately, not a whole lot of research at this time on the role of nutrition with AML specifically. I was able to find one good study from 2014 that suggests that some compounds found in cruciferous vegetables can actually slow the spread of leukemia. So that's going to be things like broccoli, cauliflower, kale, bok choy, cabbage, things like that. But most other studies really just continue to support those AICR recommendations, those general anti-cancer diets. So it kind of goes back into what we were talking about before. So this is just a list of some additional resources that we like to use. You can see the AICR is on there, Academy of Nutrition and Dietetics. We have Old Ways on there. So quite a few good ones to check out if you have the time. And I think that is all we had for you. So we will open it up to any questions now.
Thank you so much, Kathryn and Michelle. That was excellent. It was really great to see both perspectives, the perspective of active treatment and long-term survivorship. So thank you so much. Let me go ahead and share my screen again, and we can get to our questions. So as a reminder, you can ask a question or make a comment by typing it in the chat box or by raising your hand. We're a small group today, so feel free to just pop off mute if you have anything you want to bring up verbally for our speakers. I don't think there's enough of us to really talk over one another. So let me check the chat and see if I have anything coming through. And I'll be quiet for a second here and see if anybody wants to come off mute and contribute to the conversation.
I have a question I'd like to ask. Thank you very much. That was very informative. Thank you for sharing all that information. I have a question about mucositis. It just seems to be such an incredibly painful, and it seems to happen to so many patients. I know my husband had it when he was battling AML. And I don't think I've read anything that there's really anything you can do to prevent it. I read something maybe about if you were getting a stem cell transplant, there was possibly a medication you could take. But I just wondered, is there anything you can do preventative to try and avoid it? I know that there's lots of, mouthwashes and treatments, but it's once you get it, you have to unfortunately go through the process, and it can be as long as 6 to 8 weeks to get over it. And I just wondered if there's anything you can do to help avoid it.
So one thing that we do offer for specifically our stem cell transplant patients, because the majority of them unfortunately do develop mouth sores, we offer a mouth rinse that contains glutamine. Glutamine is an amino acid that basically can help prevent mouth sores from occurring in the first place. And the one that is used at our hospital is called Glutasolve. You can actually swish and swallow, so it can help prevent some of those like sores that can even develop into the esophagus. So it kind of creates that protective effect all the way down the esophagus. So that is one thing that can sometimes be helpful for those patients.
And is that not something you would recommend for someone that's about to go through induction chemo potentially as well?
Mm-hmm. Yeah, absolutely.
Okay.
Yep, can be used.
Okay, great.
If that's pretty standardly used across the country, is that very specific to your facility that you use that for induction potentially and during the transplant phase, or is that something that patients should be actively asking for, like trying to be proactive about this prevention and getting it under control? I'm just wondering if that's something that they should be bringing up more with their medical team.
Mm-hmm. Yeah, and really there is conflicting like research out there if glutamine truly is helpful or not. So you kind of get a little bit of like back and forth, but I really can't speak to if other facilities are using it, since I've only ever worked at the UT Southwestern Hospital and now on the outpatient side. So I don't know if really other facilities are using it on a consistent basis or not.
Yeah, sure. Yeah, so maybe it's something to jot down if you're kind of in that phase of treatment now and you're listening. If it hasn't been brought up to you before and that's something you're struggling with, it might be worth speaking to your medical team about.
And I'll just add, it is something that you can purchase. So it's not a prescription. So it is something you can buy. And there's another rinse on the market. And you're absolutely right. There are so many rinses out there, but the promising research on glutamine, I think, is something to be hopeful for. And that rinse is called Helios. And it is flavored versus Glutazolve is not. So that's another option, just to have something else. There is a prescription called Mugard, Mugard, that is a rinse that can kind of coat the mouth. And there's some research going on with more head and neck related mucositis. So that's more related to radiation, but definitely still in the same area and same issues that are going on with, that induction chemotherapy and transplant. So it is a prescription. The issue with the rinses that are prescription is insurance coverage. So it can be a real challenge to get it covered. And then the out-of-pocket cost, as you can imagine, is quite costly. But that is the one rinse that I'm aware of that is more of a proactive product versus a reactive rinse.
Great. That's really helpful. Thanks for providing the names of the different ones to look for. I'm wondering if, while we're on the topic of supplements, that maybe we could talk a little bit about what you brought up earlier, Michelle, about liquid calories, and maybe talk about some of the useful products that are providing us liquid calories that maybe we could look out for or ask about.
Yeah, great question. So during treatment, like we discussed, the goals are different. So we are a little bit less concerned about some of the things that Kathryn mentioned, like those sugars and saturated fat, just because we're trying to get in the calories. So some of those liquid supplements, as far as the, nutrition facts label aren't, the ideal profile, but they definitely, serve a purpose. So Ensure and Boost are the main brands that you probably have heard of. They come in a variety of options. The Boost Plus or Ensure Plus, those have more calories and can be more beneficial when you're having more of those mouth sores and just pain issues with swallowing solid food. And then they also come in clear varieties that are more like a juice flavor, which can be really kind of soothing, a little bit easier to get down than some of those milk-based products that are just more of that milky texture. Sometimes when you're having like lots of thick secretions and things like that, that milk just kind of coats all of that mucus in there, and it can be pretty unpleasant. So we recognize that and can, alternate between some of those. And nowadays, there are more and more plant-based products that are coming on the market, and we're really excited about those because some people just really don't tolerate dairy, or they would prefer not to consume that in their diet. And so there are, a couple options, and depending on the facility, sometimes they do allow outside products as long as they are sealed. So you can purchase some of these and bring them up to the hospital if your loved one is hospitalized. But a couple of those names are Orgain is a really easy to find brand, and Kate Farms is one that's kind of up and coming and has a higher calorie option, which is really great. And it tastes good. Anything you'd like to add, Kathryn?
No, that pretty much covered it. I feel like now there's such a wide variety of options out there, which is really nice. Used to be just Boost and Ensure, choose one of the two, and that's what you get. But it's really nice, I think, for a lot of patients to be able to have something maybe like more plant-based, for example, because I've noticed with quite a few of my patients, at least, they may not be lactose intolerant, but they can still sometimes notice a correlation between like Boost and Ensure and having loose stools or diarrhea. So using more of those plant-based options can be really a lifesaver for them.
Great. Yeah, it's good that they're making progress on the taste on the plant-based options. It's really nice to hear. I have a question here from Renee in the chat who is asking what is the consensus regarding diet drinks. Her son who has AML tries to limit them to 1 per day, but it still worries her.
That's a good question. I'll go ahead and take that one, and Kathryn can contribute to anything that I missed. So diet drinks, and I'm assuming it's the artificial sweeteners in those diet drinks that you're concerned about, are still something that's continuing to be researched. The research that has come out still isn't very definitive on that these artificial sweeteners are harmful to us. But the concern is that they are several hundred times sweeter than natural sugar. And so what that does to your tongue is it makes your tongue very sensitive to this very, very strong sweet flavor. And so over time that can affect, what you crave and what flavors you enjoy. So something that's only slightly sweet, like, maybe a orange or something like that, you may not notice it being as sweet if you're consuming several of these artificial sweeteners and multiple times a day. I think just one drink or one serving, whether that's a packet of that sweetener, per day is fine. And then we also recommend kind of leaning more towards those natural forms of those sweeteners, which would include stevia and monk fruit when that's an option.
Great.
I agree with Michelle. I was going to say stevia and monk fruit are 2 really good kind of alternatives. So other than that, just outside of, potential link between some of those artificial sweeteners and cancer, there's also some research over the past few years that it can even alter our gut microbia. So it can affect our gut health more than we might even know right now. So there's so many things, I think, that at this point in time, we don't know yet. We're still, trying to see if there's correlations. So I always, recommend, if possible, leaning more into some of those more natural sugars like the monk fruit or the stevia instead.
Great. Yeah, there's interestingly some research going on now. I'm sure you are aware about our gut health and transplant outcomes, and how the bacteria we have in our gut can influence potentially outcomes of transplant or have some effect on it. So it's really interesting to read about. So it's good for you to bring up the conversation of how can we promote good gut health in potentially anticipation of a transplant. So important. Okay, anybody else have any questions or comments they'd like to pose? We have about 5 minutes till we wrap up.
I was just going to comment that I was kind of struck by the 12 to 18 ounces or less of red meat per week. And I'm not one that eats a lot of red meat, but it just reminds me that the American diet is, I think in a lot of people probably eat a good bit more red meat than that each week, but maybe I'm wrong. But I think that was helpful to see, because that's only a few servings per week if you're eating like 4 or 5 ounces at a time.
Mm-hmm. Right, so, exactly. If you go to a steakhouse and order a steak, it's going to be a lot more than
right. I mean, you could easily get an 8-ounce steak somewhere.
Yes. Mm-hmm, exactly. So that is definitely, I think, in Western diet, especially, I think we can all benefit from reducing our portion sizes of red meats and aiming for, like we said, 12 to 18 ounces, maybe 2 to 3 times a week at the most.
Yeah, that was a good reminder. Thank you.
Well, I have something we could potentially end on. You mentioned towards the end the benefits of moving towards more of a plant-based diet. So I'm curious if you could explain some of your tips or best ways to maintain good protein intake while going more plant-based.
Yeah, I mean, we can really get a lot of protein from plant-based foods. Think about things like nuts and seeds and nut butters, such as peanut butter, almond butter, tofu, tempeh. You can do like almond milk that's fortified with extra protein. I think Silk has an option that has 10 grams of protein per serving. Beans and lentils also are a wonderful protein source as well. So you can really get a lot of protein from those types of foods.
And I'll just add, there's definitely a right way and a wrong way to do a plant-based diet. So I'll give an example that, I'll rag on my sister a little bit here, that she really, because of ethical reasons, wanted to be a vegetarian and didn't really understand it, and was still eating tater tots and Oreos and all of these really unhealthy foods. So anytime you're changing your diet, you just have to be a little more intentional and purposeful whenever you're purchasing new foods and coming up with new recipes and meal ideas. So like Kathryn mentioned, making sure that you're including a good source of plant-based protein with each meal. And some of those ethnic cuisine recipes, like Kathryn mentioned, the Asian meals, or even some Hispanic meals that are just part of their traditional diet, that's a good resource because they're already incorporating those things. So a stir fry is a good example where there's plenty of edamame in there and maybe a little egg to help get in some extra protein. And you can also use complementary proteins as well. So rice and beans are a good example of that. With your nuts, if you're including a good source of whole grains, that's going to complement it and make sure that you're getting that complete source of protein.
Excellent. That was great. Thank you. Okay, so let's wrap up. I'd like to mention that our next AML Caregiver Chapter meeting will take place on July 20th from 2 to 3 p.m. Eastern. We'll be taking a little break in June, but back in late July, we'll have Dr. Sarah Tinsley, who is an AML nurse practitioner from Moffitt Cancer Center in Florida, join us to discuss the caregiver's role in side effect management. So you can find the registration page for this event probably around mid-June. And you can find others by visiting healthtree.org/AML/community/events. Once again, thank you to our HealthTree Community for AML event sponsors, Bristol Myers Squibb, Amgen, Genentech, AbbVie, and Jazz Pharmaceuticals. And thank you for helping us build a strong HealthTree community for AML. I appreciate you all for being here and really hope that I'll be able to see you again on July 20th.
Thank you.
Thank you, everyone.